congratulations, Nate. First of all, this is outstanding. I mean, the speakers that you've pulled together, I'm really honored to be part of this group. And the only thing I might ask is maybe next year, can I get CME for this? Because this is better than most of the conferences that I have to go to. So as Nate said, and great job, Preston, as well, we're going to change gears quite a lot from finance to functional medicine, patient care. But as Nate just shared, I've got a few things that I've got my hands in. Number one is that I'm the owner of Precision Functional Medicine, which is my little private micro-functional practice, where I see patients one-on-one. It's very intimate, very, coaching and trying to get those patients as healthy as possible. Really two categories of patients that I see there. Optimizers who are going to their primary care doctor asking for things that they heard about on a podcast or they read in a book, but their doctor's saying, oh, no, we don't do that here. So they come to me who's outside the system and I can help them get these tests and interpret them. The other group, the bigger group, is the complex chronic illness folks. And there are a lot of us dealing with complex chronic illness. So we'll get into that more here in a minute. I'm also the owner of Functional Health Professionals, which is a networking organization of independent, functionally minded doctors, nurse practitioners, PAs, health coaches, essentially a bunch of people who are going in this direction, but wanted to have community and the operational backbone established for them before they launch their practice. So I thought, hey, if I'm going to launch my practice, I'm going to replicate whatever I learn into other people so they can get up and running fast. So that's Functional Health Professionals. And then obviously HealthBar is an amazing company that I've been privileged to be a part of for a number of years now. So moving along here. My title is The Path from Traditional to Functional Medicine. And we're going to talk about this from three perspectives. One, that of a patient. Two, my own journey through medicine. And then briefly, I'm going to talk about this idea from more of a systemic health industry perspective, although I think we've got other speakers that are hitting on this much more thoroughly than I will. All right, so to begin, a patient story. So this lady came to me about a year and a half ago, 25-year-old female experiencing pretty significant right upper quadrant abdominal pain. She's been dealing with bloating, mixed IBS, she's got diarrhea, she's got constipation. She doesn't know what's going to trigger the next GI problem. She's gaining weight, she's losing weight. Meanwhile, not just in the GI domain, but she's got fatigue and she's got anxiety and depression and headaches and all of these different constellations of pretty common symptoms that we all hear about or experience. And she's desperate. She's been to multiple clinicians, her primary care doctor, her gynecologist, a GI specialist. She's had lab tests done, imaging, scopes, the works, right? And everything is essentially normal. Out of her desperation, she is experimenting with different diets, cutting gluten out, cutting dairy out. She's bought some supplements that she saw, on a social media post. She's really just looking for answers. And despite all of the medical appointments, she's just not making any progress whatsoever. So when I get to see her, she tells me, and she's looking at me like, can you really help me? I'm planning to get my gallbladder out in 8 days. Not because there's obvious infection or stones, it's just my pain's here and they don't know what else to do. Okay, so as is the case much of the time, everything looked normal except the patient. What do we do with this? Unfortunately, this is not that unusual. Do we have any clinicians in this room? I imagine we've got a lot of us, right? Okay. So probably on a daily basis, we're seeing patients who have complex, chronic, persistent symptoms that are spanning multiple different areas of their body. And they're seeing multiple clinicians bouncing from specialist to specialist and really just not getting any clear answers. And unfortunately, it's not really the exception anymore. It's really becoming the norm. And this is a shared frustration with our current system, right? It's primarily the patient. Patient's frustrated. They feel unheard. They're just taking more meds. They're going to more docs. They're making little progress, if any. And they're really losing hope. But as a clinician in the traditional system, we feel that too, right? We feel unequipped. We feel like we don't have time. There's certainly no incentive to learn about how to deal with these things. The system really just doesn't support learning this and implementing strategies to help these patients. So burnout ensues, right? Patients feel stuck. Clinicians feel quite limited. I'm going to pause on that for just a moment and describe my journey into what I'm doing now. I had a unique, well, here's another question for you. Anybody heard of functional medicine before? Yeah, we got lots of hands, awesome. Anybody practicing functional medicine? Yeah, okay, great. So a lot of people end up in the functional medicine space as clinicians, mostly because they become disappointed. They have lost faith because of something that's happened to themselves or a family member, somebody close to them. They went to the system didn't give them, just like this lady, that I was talking about. They've been that patient before. And so for many of us, that happens in our world, and we go, okay, I'm going to look for answers wherever I can, and they find functional medicine. My experience was actually a little bit different because I'm actually a second-generation family medicine doc and also integrative functional clinician. So my dad, back in the 80s and 90s, he just finished medical school, he was building his practice, but started to pick up on some of these trends that were happening with, like Preston just talked about, like what's going on with the hospital systems and the insurance payers, like something feels fishy here. I really want to get my patients well, but I don't feel incentivized to do that. Plus, and this was a long time ago, 30, 40 years ago, new information was coming out about the gut microbiome. Like some of us are just now hearing about that, but this has been around for a long time. So he had his ears perked to like what's going on with some of these ideas like the microbiome, with detox pathways, with nutrition, things like that. So me, as a kid growing up, I thought my dad was normal. He brought all these supplements home. He was learning about probiotics and all this. And as I got older, I shadowed him, for elementary shadow your dad day, whatever it was. And I was like, this is what doctors do. Doctors, address things from an acute perspective and also from a long-term chronic perspective. So I was inspired by my father, and I thought, he loves what he does. It's pretty cutting edge. It's cool. I'm going to go follow his path and apply to med school, do my residency in family medicine, and all that. So, well, that was a long 8 years of it's exhausting, number one, right? But number two, it was very unlike what my dad was doing, to some extent. Yeah, the labs were there. Yeah, he was doing pulmonary function testing and EKGs and chest x-rays and all those sorts of things. But philosophically, I found myself in a system that was very good at putting out fires, but not really stopping them from happening. So I was so thankful going through my residency, knowing that this was temporary. I was going to come out of this, and I was going to learn a lot about the ICU, about surgery, about babies, and all of these sorts of things. But I had something to go to after I finished this. It was also it was disheartening to look at some of my mentors who were brilliant family medicine docs, and they grew up in an era where they were doing everything for their patients. They had long relationships. They got to see their patients have kids, and then have kids, and all these multi-generational families, and they were helping them with all kinds of health concerns as they came up. Well, as a resident, they looked just despondent, discouraged, exhausted, because they just had to move people through too fast. We kind of relate to that. So I also, I kind of knew that once I get out of this, I'm going to end up doing functional medicine. Oh, and I can't wait to do it. So I came to really appreciate both the traditional model for what it can do, but also recognize that there's something missing about that, which I'd gotten an early taste for with my dad and his functional medicine practice. At the time, functional medicine wasn't a term. It was integrative, complementary, alternative, that kind of thing. But, so again, I didn't abandon my training. That's not the point of this talk, is to say traditional medicine is worthless, but it needs to be expanded, particularly in the primary care world. All right. So the traditional medicine model, this is oversimplified, but it tends to be disease-centered. We really love to come up with an ICD-10 code, all right? Because if I have my code, then I can bill for it, and I can pick my medicine, right? So, and this works great in, again, that acute situation. Somebody has a sore throat, you swab them, they've got strep throat, put the code down, get the antibiotic. It's amazing, it's beautiful. And even in other cases, like traumas or appendicitis, or there is a reason why we have that system, and we need it. But it's reactive, it's organ-based, and really as a traditional clinician, we're trained to diagnose disease, but not necessarily to understand dysfunction. Again, traditional medicine model is incredibly effective for those acute problems, but chronic disease, it's just not following the same rules. So we need a complementary lens to think through these problems. And that's basically what functional medicine is. It's a systems-based way of looking at conditions, patients' symptoms. It's root cause oriented and preventative and restorative. When I say systems-based, most of us think systems like cardiovascular system and the pulmonary system, the endocrine system. That's not the same, that's not how functional medicine sees this. Systems are concepts that touch on all of those organ systems. Those are things like detoxification, inflammation, assimilation, being able to absorb nutrients and get them to where they need to go. HPA access, so autonomic things. Somebody talked about that earlier today. Oh yeah, for performance medicine, like what's going on with your sympathetic versus parasympathetic. A lot of us living in parasympathetic way too much. So systems are not, again, musculoskeletal system, although that's a branch off of this tree. The root causes tend to be things like inflammation, sugar metabolism issues. And those are also driven by, well, by lifestyle, by genetics, by traumas and other things that are triggers and mediators. But it's not until we get into those branches of the organ system, so the cardiovascular system, if we've got high blood pressure, the functional medicine doc doesn't go, well, which medicine do you need? They go, what's triggering the blood pressure to be high? Is it a nutrient deficiency? Is it detox pathway issues? Is it parasympathetic? Like, you're not sleeping? You got sleep apnea? Like, what's underlying this? I had a patient do an introductory call with me yesterday, and he said, hey, I just want to know, if I'm coming to you for anxiety, what are you going to do for me? And I pause, and I go, well, it depends why. Anxiety is one of these tip of the iceberg symptoms like fatigue, like IBS, that we need to uncover what's the reason for that for you. It's not just which med's going to be best, but is this driven by your adrenal glands, by your blood sugar dysregulation, by inflammation? Again, some of these key concepts. So that's how functional medicine thinks. Not what's the disease and how do we match it to a drug. So traditional, what is this disease? Functional medicine's asking, why is this happening? Okay? Instead of treating symptoms, just kind of throwing a Band-Aid on something, we want to address those root drivers. And also, an important piece of this is traditional medicine tends to be episodic. You know, they just come back next week, come back in a month, whatever, we'll deal with your next one, your next symptom. Functional medicine is more longitudinal. It's very akin to lifestyle medicine. In fact, I incorporate health coaching all the time with my patients. So we're looking at long-term improvements in care. But as I said at the beginning, both of these are very necessary. Okay, so what does functional medicine actually look like in practice? Well, number one, we need longer visits. The 5, 6, 15-minute appointments to talk about one problem, it's just not going to do it because the vast majority of my detective work happens as I'm listening to a patient. So a patient comes to me, and yes, I've had them fill out an intake form, so I've got a clue about their symptom score, and I know a little bit about what medicines they're taking, what supplements, and maybe what traumas they've had. But one of the things that I saw happening to me as a traditional doc was that all I really cared about mostly was the chief complaint, right? I see that on the chart, that's what the nurse put on there, and I've already, in my head, mostly made up my mind about what I'm gonna do for this patient, just by seeing whatever that label was, right? In the functional medicine world, I can't do that, okay? Because I need to hear them out. They may have said, well, I have headaches, but I need to go, well, what kind of headaches? When do they happen? All of these root things, I need to explore all that because the headache is not the problem. The headache is those root drivers that are causing the headache. Does that make sense? And it might be musculoskeletal for one person, it might be dehydration, it might be sleep, it might be who knows what. I need to talk to this patient. I need to get more and more information. The other part of that, and that's part of the deep history, the timeline, understanding what happened, when it went awry. Did you ever feel good? That's a common question I ask patients. Can you remember a time in your life when you just felt the best? A lot of people go, I don't know, not really. Maybe I was okay, after I had my second child. But that's a clue. Then I go, okay, what was happening then? And we start to pull out those wins that they've had in their life and see if we can replicate and understand why that worked well. Another really important thing about longer visits is that I think there's a therapeutic impact when a patient finally gets to tell their story. Part of the distrust I think that patients start to have with their clinicians is that they don't trust that their clinician has heard all the details enough to make a wise decision for them. That make sense? So if you're not heard, if you haven't been heard, then trusting that this medicine that they want to put you on is the right thing might not jive. And how many times has a patient been prescribed a medicine that they decided even before they left the office, oh, I'm not gonna take that, right? But they nod their head and say, okay, and then they just end the visit. So I think there's a therapeutic impact just for a patient to know that this doctor, this clinician, has heard me out entirely from start to finish. Okay, now I feel more confident moving forward that he has my best interest in mind and that we're gonna find some solutions. Again, as we're listening to that whole story, we're trying to pick up patterns. But then the other really important piece about functional medicine is that we've got a larger testing and treatment toolkit. What do I mean by that? Well, as I alluded to earlier, sometimes you have a patient who comes to me because they say, hey, I want this test to be done. I heard Huberman talk about it, or Peter T, or whatever it was, and my doc won't order it. Can you do that for me? So some of the testing that I do is it's available at Quest or LabCorp. It's just blood work, right? And it's tests that we've known for a long time can be very helpful at understanding some of these things. But again, a lot of times patients they're not ordered those tests. Sometimes they come to me and they say, yeah, my doc just ordered a whole workup on me. I go, yeah, right. What was it? It was a CBC, a CMP, and maybe a lipid panel, right? That's the full workup. And I go, I mean, it's helpful. It's nice to know that you're not in kidney failure and that your liver is doing reasonably well, but there's more to know here. So for most of my patients, I end up doing a pretty decent look at blood biomarkers. Again, insulin resistance is huge, and we can pick up signals on that way earlier than, oh, you've got diabetes now, congratulations, right? We can turn this around way earlier. Heart disease, why are we only doing LDL when we have ApoB and we got lipoprotein A? Like there's other markers that help to stratify cardiovascular risk. Nutrient deficiencies all the time, right? B12, omegas, D, magnesium, zinc, all the time I find these, which sort of begs the question of what are you eating, number one, and then what's also going on with your gut? Because if you're not sucking in the nutrients like you need, well, maybe we gotta look at that part too. Endocrine system, thyroid, adrenal glands, inflammation markers. So there's really a huge panel of things that we can test. Sometimes these can even be processed through insurance, although, I mean, I could talk another hour on just the insurance part of things. More and more, just like Preston was talking about, like I'll ask a patient, do you want to run this through insurance? Say no, because they're going to inflate the price by, I don't know, $500 set of tests becomes $3,000, and then they pay for half, and you're still, paying 3 times what you would have, just cash. So I really try to dissuade patients from using insurance if they can do that. Additionally, so we talked about blood work. There's a lot of blood tests that we can do that sometimes can be run through insurance. Then there's this whole world of specialty tests. People are becoming interested, again, in the microbiome. We can learn a bit about the gut microbiome through stool testing, through SIBO breath testing. We can look at hormone metabolism through urine metabolites. We can look at the adrenal gland function. We can look at toxins. We can look at genetics. I mean, there's so many things. There's a lot of data out there, right? And part of what my goal is with patients is to help them discern, all right, so there is all this potential data out there. What makes the most sense for me right now in this moment that's not going to be, A, crazy expensive, and B, actionable and not overwhelming? Because that's sometimes the other side of, too much information can be a problem as well. So again, we're looking for patterns, not isolated problems. All right, I've hit on this a little bit already, but common drivers of dysfunction. The gut microbiome. Like we've heard about that. We know about probiotics and prebiotics and now postbiotics. Like what's happening with our gut microbiome, because that plays a huge role, again, in absorbing nutrients, in regulating neurotransmitters, in reducing inflammation. Autoimmune disease is linked heavily to the gut microbiome, and there's tons of autoimmune problems emerging. I think every other commercial is, a drug commercial on some autoimmune drug, right? So the gut's huge. Inflammation, people have all kinds of sources of inflammation, and that impacts everything from their brain to their bones to their gut to, neurotransmitters and all these things. The autonomic nervous system, I talk about this quite often with patients. The HPA, hypothalamic pituitary adrenal gland axis, are we in that sympathetic fight or flight state all the time? Are we moving into parasympathetic? What are you doing to improve that? We're talking about box breathing or mindfulness, meditation, those sorts of things. Blood sugar regulation, fascinating, right? Going on that, doing that 15-day detox, cutting out processed foods and sugars, and how quickly biomarkers start to change, right? So blood sugar dysregulation is super common. Hormone regulation, all kinds of people, women dealing with infertility, with PMS, with irregular periods. Like, what's that all about? Well, here's kind of a fun domino effect that I see quite often. And this actually will play into the patient that I saw earlier. High stress environment puts us into a parasympathetic state, so we downregulate our digestive enzymes and our stomach acids. So now we're not breaking down food as well. We're getting kind of stressed out, we're getting some heartburn, so we start taking antacid medicines, which further downregulates your ability to process foods. That ends up leading to a dysbiosis, problem with your small intestinal bacterial overgrowth is what SIBO is. So you end up having this bacterial overgrowth in your small intestine. Those bugs that grow there really love eating certain types of foods, like cruciferous vegetables. So when you consume cruciferous vegetables, broccoli, cauliflower, Brussels sprouts, those bugs, they start to metabolize it, they release a bunch of gas. So now you're really bloated and you feel miserable, and so you're not gonna eat cruciferous vegetables. But cruciferous vegetables have calcium D-glucarate in them, which helps with estrogen detoxification. So now periods are getting screwed up because you can't break down estrogen properly. So this is an example of like how these dominoes just, and we go, okay, well, it's not that you need ibuprofen or Midol or, Gas-X or whatever it is. We need to go back, we need to set the foundation right, because this all started with high stress and perhaps some trauma or something that happened in there. We need to start there, we need to rebuild the microbiome, put back some of those nutrients, and okay, here we go. Now we're making some progress. I ran through that super fast, but hopefully you kept up with me there. All right. Again, this kind of goes without saying, but lifestyle is absolutely critical. And right, it's not as sexy as, the surgery or whatever it is, but it's so essential because it's those day-to-day inputs that really drive health. And, the dark side of functional medicine, what I do, we accuse the traditional world of being a pill for every ill, right? But what does the functional med docs do? They do a supplement for every symptom, right? And if we ever want to deprescribe medications or supplements, then we have to put these pieces in place because this is what's going to sustain a patient in the long run. All right, let's get back to our 25-year-old female. So she gives me her whole story. I pick up on these little clues and patterns. I'm kind of nervous because she's supposed to have her gallbladder out in 8 days, and I don't necessarily want to get in the way of that. But if she gets her gallbladder out, you can't go back from that. So I said to her, if you're okay with this, this is what I see happening in your timeline and what's happened. What if we know it's your right upper quadrant, your liver enzymes are fine, your gallbladder's it's got some biliary sludge in there. Why don't we do some enzymes focused on improving bile flow? And in her case, I use something called phosphatidylcholine to help thin the bile, help that move out a little bit. So let's start that. Let's get some of these tests going. I think you might be one of these SIBO candidates with the small intestinal bacterial problem, and see what we get, okay? Some targeted interventions, pause on the surgery unless you get a fever, unless it's intractable pain, then get to the hospital, right? We're thankful for the traditional model for that. Well, fortunately, nearly 18 months later, she has her life back and still has her gallbladder. Yay. So it's not necessarily, I don't tell that story obviously to say, oh, look how amazing this is, but it's an example of how a functional medicine approach can sometimes really change the course of somebody's health history, okay? Now, real briefly, in my last couple minutes, there are a few challenges with scaling this. Access, for a patient, who can they go to? I think there are more and more clinicians that are emerging that want to do this kind of medicine. In fact, that's what functional health professionals is all about. It's helping empower clinicians to be able to start seeing patients on their own. There are financial costs. It can be expensive to pay out of pocket to see a functional clinician. And then to do the specialty testing. It can be a few $1,000s to get going. The irony of all of that, though, as illustrated in my patient, what costs more? The gallbladder surgery or what I did? Mine was far less expensive and saved her gallbladder, right? And then consistent touch points. Patients, we're kind of trained to just show up when we need help. And as I mentioned earlier, consistency and that longitudinal relationship is really important to gain progress and maintain it. On the clinician side, when you're spending long periods of time with your patients, you can only have so many patients in your census. It can be expensive for clinicians to deliver this kind of care. Sometimes, and some of you might be wondering, where do I learn about functional medicine? There are some good businesses and institutions out there that help with this. In fact, some of the clinicians that are in my functional health professionals are pretty new at functional medicine, but being connected to a community helps them feel like they're not so on their own. Because employment is another challenge with this. Sometimes clinicians are in the traditional model, they start to learn about functional medicine, they want to apply it, but they're not really in a system that will let them do it. So then they start to look for other jobs, but can't find one. So then they go, well, maybe I'll start my own practice on the side, but how do I do that? So, but essentially, we want integrated delivery strategies. So we want to bring care closer to patients. HealthBar is doing this amazingly well, right? That's one of the reasons I love being part of that team, is because they're putting clinicians who are thinking this way into businesses and into schools. There's actually another startup in the Grand Rapids area here doing this in nursing homes and assisted living centers, which I think is also brilliant. Another solution is to utilize more technology, which we're doing, right? We're using AI, we're using wearables, we are using virtual appointments, right? But it's true. A lot of my patients, if they can come in, they want to do that. But utilizing telehealth allows more access. Affordability strategies, we've kind of covered some of those, and I think we will a bit more later on today. And another big win is when we have primary care clinicians who are trained in the traditional model, but then they incorporate functional medicine, it actually allows for better continuity. And also, if I can deal with the strep throat and I can also talk to them about what the antibiotic might do to their gut microbiome so we can prevent long-term issues from using that treatment, if we have it all under one house or one clinician, that's also a cost-saving mechanism. All right, and then kind of almost to the end here, why does all this matter? Well, we really want to improve access because that's going to improve engagement. Engagement's going to drive outcomes, and then ultimately that lowers costs when we have healthier patients by kind of applying this functional medicine paradigm. All right, so the future of medicine isn't just traditional or functional medicine, but it is it's an integration strategy delivered in ways that fit people's lives. And I think it's just so inspiring to be here with all of you, so many different innovators, and it really makes for the doom and gloom of Preston to start to take on a little more sunshine, I guess. All right, thank you very much.